Hi, my name's Kirsten Eagles. My student number is T00698082. And today I'm going to be going over the steps for a male dog catheterization. So the first step is to gather all of our equipment. So we have our antibacterial scrub, just our betadine solution. Then we have our warm water with our sponges in here. For our final prep, we would fill up a syringe just with diluted betadine solution. Then we have our 3 ml syringe for collecting the initial urine sample that we'll discard. And then we have our 12 ml syringe to collect our sample. For the sample, we would put it into a sterile container here. Then we have our catheter. So size-wise for catheter, for say like a Labrador retriever, would be probably around an 8 to 10 French catheter. Lengthwise, you'd probably be looking at about, this one here is 41 centimeters. You can go anywhere from 41 to 55 depending on the size of the dog. Then we have our sterile lube. You can get the ones with the xylocaine gel just to make it a little bit more comfortable. You can use sterile gloves, it's optional. And then again, we had our sterile urine container. Okay, so to start, the dog would be restrained in lateral recumbency. Usually not any sedation is needed for that. So it's just making sure they're not going to be moving around too much for the procedure. Then you're going to clip any long hairs that are on the prepuce that might get into the way. You want to be careful when you're shaving the prepuce just not to cut it. If you're doing it sterilely, you can flush the prepuce with the betadine solution, but just for routine catheterization, it's not really necessary. So we're going to gently wash the tip of the prepuce and around. So you'd use 3 scrubs. So you would use the betadine solution using that circular motion going outwards, and then we'd rinse with water, and then another betadine, water, betadine, water. And then after that, you're going to wash your hands for a minimum of 30 to 60 seconds with that same solution that you're using, just to make sure that you're extra clean. And then we're going to measure the catheter length against the dog. So while it's still in the package, you would put the end of the catheter kind of where it's going to be coming out at the tip of the penis, and then curl up around the hip joint down to about where the bladder would be, just to make sure that you have enough length and that you have the proper size. From there, you would open the catheter, making sure that you keep it sterile. So making sure that nothing touches the end of the catheter tip. And then you can put a drop of your sterile lube just right onto the package, just so that you can dip it in there later and make sure that it all stays sterile. If you're going to be putting sterile gloves on, then you would put the sterile gloves on after doing that. And then from there, you're going to externalize the penis. So with one hand, you're going to kind of grab behind the prepuce and feel for the os penis and kind of push forward, while with the other hand, you're pushing back on the prepuce to externalize the tip of the penis. And then from there, you're going to hold on to the prepuce with the other hand just to make sure that the penis doesn't slide back in. So after you have the penis externalized, you're going to gently dab the end of the penis with the antiseptic solution, or just kind of dribble it on if you had it drawn up in a syringe there. You don't want to scrub the penis because it will irritate it. And then you're going to grasp the catheter with the making sure that you're not touching the actual tip itself, and you're using either the cloth in the package, or that you're using your sterile glove. Then you're going to dip the catheter into the lubricant. You want to make sure that the end of the catheter that's going to be out isn't touching the table or anything like that, so you can have an assistant hold that up for you. So you're going to find the urethra. You're going to gently insert the catheter and begin to pass it through the urinary tract. You will feel some slight resistance when you go past the os penis, and then as it curves around the ischial arch there as well. You're just going to apply some gentle pressure. If you're getting too much resistance, you want to back out and maybe try a different size catheter. So you want to pass the catheter until you get that mental mark of where you noted for the size when you did the sizing. Urine's going to start to flow out, but if you're not getting a good flow, just continue to kind of gradually go further. And then once you have a good flow of urine, you're going to attach your 3 ml syringe, and you're going to draw out the first 3 ml just because that could possibly be contaminated. You can discard that, and then you'll attach your larger syringe and draw up your 6 ml, 5 to 6 ml of urine for your sample. And then that will be put into the sterile container. And then after you've gotten your sample, you can withdraw your catheter. So you want to make sure that you put the prepuce back and then kind of hold the tip while you're pulling the catheter out, because you don't want to be pulling on the penis itself. So you just kind of allow it to slide out. And then just ensure that everybody's cleaned up and free of soap, and let the animal back up and get them comfy.